Welcome back to Senior Healthty Care, where you will discover several recommendations for seniors. Today, we provide essential suggestions for seniors that cannot be overlooked. Core after 50, 3 safe moves that protect your back. In popular discourse, the idea of core strength is commonly reduced to an aesthetic aim, such as developing a toned midsection or noticeable abdominal muscles. However, the practical relevance of core strength is far more broad and particularly relevant for those who are over the age of 50. There is a growing consensus among healthcare professionals and fitness experts that it is necessary to maintain a well-conditioned core in order to age effectively. The abdominal wall rectus, abdominis, external and internal obliques, transverse abdominis, the lower back muscles, multifidus erector spinae, the pelvic floor, and the hip muscles gluteals, hip rotators, iliopsoas, are all included in the muscles that make up the core. The core is not just a single muscle or a particular group of external abdominal muscles. Rather, it is a complex and integrated system of both deep and superficial muscles that encompasses the trunk. The muscular system acts as an internal corset, performing a variety of functions including the stabilization of the spine, the facilitation of efficient force transfer between the upper and lower body, the assistance of balance and posture control, the enhancement of breathing mechanics through coordination with the diaphragm, and the support of internal organ functions, including the mechanical processes of digestion and continence. As individuals age, there is an inherent inclination towards a gradual decline in muscular mass and strength, a phenomenon known as sarcopenia. Sarcopenia is exacerbated by extended durations of inactivity, sedentary occupational practices, chronic pain conditions, such persistent low back pain, and a general decline in total physical activity. Aging induces neural alterations, motor unit recruitment patterns, shift response times diminish, and proprioception deteriorates. When the muscles of the core weaken or lose coordinated control, a series of functional issues may ensue. Common issues include persistent lower back discomfort, decreased balance, increasing fall risk, reduced mobility, and escalating reliance on others for everyday tasks. From a pragmatic perspective, a weak or inadequately coordinated core may render fundamental activities such as standing from a seated position, ascending stairs, securely reaching above, transporting goods, or entering and exiting a vehicle more challenging and dangerous. Due to these repercussions, it is beneficial to reorient core training for older persons to prioritize safety, functionality, and longevity above aesthetics or high-intensity performance. The objective is not to get a flawless six-pack, but to develop a core that consistently stabilizes the spine and pelvis coordinates with limb movement and facilitates the safe execution of everyday activities. This comprehensive method emphasizes motor control endurance and multi-planar stability, instead of focusing just on isolated strength in one plane. This guide delineates 3 fundamental workouts that engage the deep stabilizing muscles, the posterior chain, and cross-body coordination movements that are low-impact, readily adaptable, and effective, without the need for specific equipment. It highlights 3 frequently performed core exercises that often place undue or preventable stress on the spine and hip joints of older persons, and it provides safer, functionally relevant alternatives. The aim is to provide a pragmatic, evidence-based paradigm that assists older persons in developing a robust, stable, and functioning core to enhance daily living and mitigate injury risk. Fundamentals of core training post-50. The most beneficial core workouts for older individuals emphasize stability, motor control, and muscle endurance, rather than repeated spinal flexion or high-velocity loading. Functional core strength is defined as the trunk's capacity to resist undesired motion while facilitating limb movement rather than only generating observable flexion or extension. The core muscles often function isometrically or eccentrically to regulate movement and uphold posture. Hence, training that prioritizes control timing and prolonged contraction under little load is most effective for everyday tasks. Numerous factors need to direct the choosing and execution of exercises. Maintain neutral spinal position and synchronize breathing with muscular engagement. Effective diaphragmatic breathing engages the pelvic floor and transverse abdominis to provide optimal intra-abdominal pressure that stabilizes the spine. Motor control. Prior to load, establish appropriate activation patterns, timing, and coordination for the deep stabilizers before introducing substantial resistance or extended lever arms. Implement progressive overload in functionally relevant manners. Augment difficulty by extended holds, reduce tempo, intricate limb patterns, or light resistance bands instead of abruptly transitioning to substantial axial loading or repetitive flexion motions. Multiplanar and anti-rotation training. Daily activities seldom require the trunk to flex and stretch in isolation, hence resisting rotation and shear is essential for safe mobility. Individualization and regression, shock progression. Align workouts with pain levels, mobility limitations, cardiovascular endurance balance, and previous surgeries or chronic ailments. Frequency and consistency. Brief regular practice sessions 2 to 4 times weekly that prioritize high-quality repetitions provide superior neuromuscular adaptations compared to infrequent exhausting sessions. 3 fundamental exercises. The following 3 exercises crafted to prioritize optimal muscle activation, maintain neutral spinal posture, and use progressive loading, where suitable are intended for regular practice, to immediately enhance daily movement patterns and to be modified for various skill levels. 1. Supine marching, stimulation of the deep core and stabilization of the pelvis. A moderate but extremely powerful activation exercise is supine marching. Initially, it seems to be a basic action, yet its primary significance is in teaching the transverse abdominis TVA, the deepest abdominal muscle, to contract in synchrony with limb movement. The TVA encircles the body and functions as an internal corset to provide support for the lumbar spine. Besides activating this muscle, supine marching instructs the neural system to preserve pelvic stability throughout limb movement, a vital competency essential for safe ambulation stair traversal and transitions in and out of seats or beds. Methodology and rationale. Position recline supine on a solid surface, such as an exercise mat or carpeted floor. Flex the knees and align the feet at hip width, ensuring the heels are positioned at a comfortable distance from the buttocks. Position the arms beside the body with palms facing downward. Ensure the cervical region and shoulders are at ease. Activation. Inhale naturally, and as you exhale gently, bring the navel toward the spine. Imagine zipping up a snug pair of jeans rather than forcefully sucking in. Ensure optimal respiration. Movement maintain pelvic stability, while gradually elevating the right foot a few inches above the floor, drawing the knee toward the chest to the maximum extent feasible without allowing the lower back to arch or the pelvis to tilt. Pause momentarily, then descend the foot in a controlled manner. Reiterate on the left side. 1 repetition cycle involves 1 lift on both sides. Dosage initiate with 10 lifts each leg, 20 actions in total, advancing to 1 to 3 sets based on individual capabilities. Allow a rest period of 30 to 60 seconds between sets. Advancements and setbacks. Regression. If elevating a foot proves difficult, focus on breathing and pelvic awareness, the TVA pull, and maintain it for a certain duration of breaths. Alternatively, glide one heel down the floor away from the body and then return it rather than raising it. Progression. Extend the duration of hold time prior to leg transition, include a light ankle weight once form is maintained, or execute the same movement in a half-bridge posture, marching with hips slightly lifted to integrate gluteal activation and core stability. Frequent errors and signaling. If the lumbar region arches, decrease the lift height and instruct to maintain a neutral spine, or engage the core by drawing the navel towards the spine. Positioning a hand under the lower back may provide tactile feedback. If the hand loses touch, it indicates an increase in lumbar arch. Inhale consistently. Exhale throughout the movement to promote TVA activation. Proceed with caution and intention. This emphasizes quality over speed. Operational transfer. Supine marching cultivates the timing and endurance essential for consistent pelvic control during ambulation-secure stair navigation and transitions from a seated position. It may also mitigate the propensity of the lumbar spine to compensate during limb movement, hence decreasing the probability of uncomfortable compensatory tendencies. 2. Glute bridge involvement of the posterior chain and pelvic stabilization. The second fundamental exercise focuses on the posterior chain, the glute bridge. This exercise mostly stimulates the gluteal muscles and hamstrings while working the lower back extensors more healthily than extended sitting or compensatory lifting techniques. Prolonged sitting often results in gluteal weakening, referred to as gluteal amnesia or dead butt syndrome. Therefore, restoring robust and coordinated hip extension is essential for pelvic stability, proper posture, and alleviating compensatory strain in the lumbar spine. Methodology and rationale for efficacy. Position. Assume a supine posture with knees flexed and feet resting flat on the floor aligned at hip width. Adjust the heels to a distance that is easily accessible with the fingers. Activation. Commence a subtle core engagement akin to supine marching while deliberately contracting the gluteal muscles. Execution. Apply pressure through the heels and elevate the hips until the body aligns in a straight line from shoulders to knees. Refrain from lumbar hyperextension. The motion should originate from the glutes and hamstrings instead of arching the lower back. Maintain the apex posture for 3 to 5 seconds, ensuring a glute contraction and a neutral core, then descend gradually, articulating the spine vertebra by vertebra. Dosage target: 10 to 15 repetitions for 1 to 3 sets. Advancements and setbacks. Regression. Elevate the hips slightly to concentrate on the glute contraction without using the whole range of motion. Position a folded towel under the sacrum for enhanced comfort if necessary. Progression. Incorporate a resistance band over the thighs, exerting outward pressure on the knees during the lift to enhance activation of the gluteus medius and external rotators. Progress to single-leg bridges after a bilateral bridge is performed consistently and without discomfort. Time-based holds, e.g., 30 to 60 seconds, may enhance endurance. Prevalent errors and signaling. If the lumbar region experiences strain, initiate a reduced lift accompanied by a more robust gluteal contraction. Visualize shutting a vehicle door with the hips to engage the posterior forcefully. Ensure that weight is distributed via the heels and mid-foot rather than the toes. Loosen the neck and shoulders, avoid exerting force with the upper body. Exhale during the lift to enhance core activation. Operational transfer. Enhancing gluteal strength optimizes standing posture, stabilizes the pelvis during locomotion, and facilitates force distribution during stair ascent and lifting activities. Robust gluteal muscles contribute to urinary continence and dynamic stability, particularly during lateral movements and unilateral stances. 3. Bird dog cross-body coordination and anti-rotation stability. The third fundamental exercise is the bird dog, a dynamic stability movement executed from a quadruped posture on hands and knees that incorporates core strength balance and cross-body coordination. The bird dog exercise compels the trunk to maintain a neutral spine while opposing limbs are in motion, instructing the body to counteract rotation and to stabilize during contralateral movements that characterize ambulation and many functional tasks. The bird dog exercise enhances core stability against rotational forces, anti-rotation, and increases proprioception, making it directly pertinent to fall prevention and activities necessitating coordinated reaching, carrying, or walking. Methodology and rationale for efficacy. Position hands aligned with shoulders and knees aligned with hips, spine in a neutral tabletop orientation. Activation. Engage the navel towards the spine while maintaining a neutral pelvis and ribcage, prevent any sagging or arching. Movement. Gradually and concurrently, stretch the right arm forward and the left leg straight back, elevating them to torso height to create a continuous line from fingers to heel. Maintain alignment of the hips and shoulders parallel to the floor. Refrain from tilting or twisting the rib cage. Maintain the position for 3 to 5 seconds with consistent breathing, then return to the initial position in a controlled manner. Perform the same action on the other side. Dosage: 8 to 12 repetitions each side, 1 to 3 sets. Advancements and setbacks. Regression. Engage in single limb lifts, elevate either the arm or the leg until stability improves. Alternatively, do the exercise from a standing posture against a wall by extending one arm and the contralateral leg while maintaining grip on a firm surface for support. Progression. Incorporate a little crunch by bringing the elbow and knee towards the body after extension before to re-extending to enhance dynamic demand. Extend hold durations or execute from an unstable surface, advancing gradually and with caution, such as on a folded pad. Frequent errors and signaling. Refrain from elevating the arm or leg above the body. Excessive elevation induces lumbar hyperextension. Maintain a neutral neck position by directing your gaze to the floor several inches in front of your hands. If the pelvis rotates, instruct to square your hips and decrease the range until proper control is achieved. Proceed at a deliberate pace. Rapid movement diminishes neuromuscular control and the difficulty of stabilization. Operational transfer. The bird dog exercise prepares the neural system to sustain trunk alignment during contralateral limb movements, enhancing gait mechanics, mitigating rotational collapse when reaching and augmenting balance, while doing activities such as transporting goods while ambulating. Supplementary workouts and modifications. Although the 3 aforementioned exercises provide a robust foundation, additional motions may enhance the program as proficiency improves. These consist of plank variations. Forearm or high plank engages the core isometrically to counteract gravity. Assume a kneeling position for decreased intensity, or do side planks modified on the knees to target lateral stabilizers. Maintain the position for a duration of 10 to 20 seconds, gradually increasing to 30 to 60 seconds. Palloff press, a standing anti-rotation press, using a laterally attached resistance band that compels the trunk to withstand rotational forces, closely resembling everyday activities such as pushing a shopping cart or stabilizing an item while in motion. Farmer carry ambulating while bearing moderate weights in each hand enhances trunk rigidity and grip strength, hence augmenting functional endurance for routine carrying activities. Single leg stance with reach enhances balance and challenges core stability in a functioning position. Dead bug. In the supine position, the contralateral arm and leg descend from a tabletop posture, training intra-abdominal pressure and pelvic control with a reduced lumbar load compared to straight leg lowers. These enhancements facilitate training in standing loading and multiplanar environments, hence aiding the transfer of gym-derived improvements to everyday activities, exercises to circumvent or alter. Equally crucial to determining actions is acknowledging what to eschew or substantially alter. Numerous well-recognized core activities that were formerly fundamental to fitness routines now have a less advantageous risk profile for aging spines. The overarching theme of the exercises to avoid includes frequent or excessive spinal flexion extended lever arms that impose significant demands on the lumbar stabilizers and machine-based single-plane motions that fail to represent functional trunk use. The 3 particular exercises examined here, the conventional sit-up, the straight leg rise, and machine-assisted abdominal crunches, demonstrate these issues. 1. Conventional sit-up. The conventional sit-up has been a prevalent fitness assessment and exercise mainstay for decades. Nevertheless, it is now mostly dissuaded by spinal experts and physical therapists for older demographics. The action necessitates frequent and often vigorous bending of the lumbar spine as the body transitions from supine to seated position. This motion exposes the intervertebral discs to significant compressive and shear stresses, Investigations in spine biomechanics, including the contributions of specialists like Dr. Stuart McGill, have shown that repeated flexion under load is a primary cause for disc herniation. As individuals age, intervertebral discs gradually dehydrate and lose flexibility, rendering them more susceptible to damage. Thus, frequent sit-ups may increase the risk of disc disease and persistent low back discomfort. Moreover, the sit-up is mostly influenced by the hip flexor muscle group, particularly the psoas major. The psoas muscle originating from the lumbar vertebrae may lead to excessive curvature or changed spinal mechanics due to chronic overuse and shortening, particularly in those who sit for prolonged periods. Sit-ups often exacerbate the imbalance they want to rectify. They strengthen and shorten the hip flexors instead of enhancing the stabilizing function of the anterior abdominal wall. Numerous practitioners also use improper head and neck postures during sit-ups, exerting force on the cervical spine with their hands and causing neck discomfort or tension headaches. More secure alternatives, supine marching and dead bug exercises, substitute complete sit-ups with motions that promote pelvic stability during limb motion, hence reducing repetitive lumbar flexion. A modified crunch, characterized by a moderate curl, with a neutral pelvis, and a little elevation of the head and shoulder blades, may be executed periodically if preferred. Nevertheless, activation of the hip flexors should be modest, and the action should be restricted in range. 2. Straight leg raise. The straight leg raise, including the elevation of fully extended legs towards the sky, ostensibly focuses on the lower abdominals, yet its biomechanics significantly increase the risk of spinal strain. Maintaining straight legs creates an elongated lever arm, wherein the weight of both legs exerts significant tension on the pelvic and lumbar spine. To counteract that torque, the abdominal muscles must exert significant energy to avoid pelvic tilt, a feat that most individuals, especially those with a weak core, struggle to do. When the abdominal muscles are insufficient, the lumbar spine may hyperextend or compress, imposing excessive strain on spinal joints and discs. Furthermore, the straight leg rise is mostly influenced by the hip flexors rather than the actual lower abdominals, highlighting the prevalent imbalance of tight anterior hip musculature and comparatively weak deep stabilizers. Individuals with pre-existing spinal conditions, such as degenerative disc disease, sciatica, or lumbar stenosis, may find that the straight leg raise exacerbates symptoms by elevating discal pressure or irritating nerve roots. More secure alternatives: reduce the lever arm. Bent knee leg lowers or the sequential lowering of one foot from a tabletop posture. Knees flexed at 90 degrees, reduce lumbar strain while maintaining a challenge to control. Supine marching provides an additional secure alternative. For those desiring an increased challenge to the lower abdomen, execute gradual one-leg lowers while stabilizing the opposite hip, maintaining a neutral lumbar spine and stopping when pelvic tilt is imminent. 3. Machine-assisted crunches and uniplanar loaded flexion. Numerous commercial abdominal crunch devices are promoted as convenient methods for isolating the abdominal muscles. Nevertheless, they often result in non-functional strengthening and may impose detrimental patterns on a susceptible spine. Machines often restrict the body to a single plane of motion that fails to replicate the core's functionality in everyday activities. Users engaging in weighted or assisted crunching exercises on these machines often promote spinal flexion under load, a practice that biomechanics experts advise against for long-term spinal health. Ergonomic discrepancies are prevalent. The rigid alignment of the hips and torso in some machines may not accommodate all body types, resulting in unnatural ranges of motion or prompting users to compensate by exerting force with their arms or straining their necks. In older persons, especially those with diminished bone density or osteoporosis, the compressive stresses from certain machine-assisted flexion exercises may increase the risk of fractures in susceptible vertebrae. More secure alternatives: anti-rotation and isometric exercises. Planks, Pallof presses, standing anti-rotation holds, and bird dogs engage the trunk effectively while avoiding recurrent spinal flexion. Resistance band rotations executed with an emphasis on control are also beneficial. Functional lifting mechanics, instructing on correct hip hinge mechanics and loading patterns, e.g. deadlift technique with minimal weights under expert guidance, can more effectively enhance the capacity to lift and transport in everyday activities. Software development and advancement. Implementing these options requires a systematic methodology. The aim is to develop a program that is sufficiently frequent to alter brain patterns and enhance endurance while remaining moderate enough to prevent irritation or discomfort. Here are pragmatic recommendations for designing a progressive and secure program. Frequency and duration. Target 2x4 concentrated core workouts weekly, each lasting 15 to 25 minutes. Integrate core exercises with general cardiovascular activities, walking, swimming, cycling, and full-body strength training, 2-3 times weekly to comprehensively combat sarcopenia. Illustrative session framework. Warm-up, 5-10 minutes of light mobility activities, walking, leg swings, cat-cow stretches, and hip circles to enhance circulation and lubricate joints. Activation, supine marching, or dead bug. 10 repetitions per leg or 8 to 10 controlled descents. Strength glute bridges, 10-15 repetitions, 1 to 3 sets, and plank variants 3 sets of 20-45 seconds, according on individual capabilities. Coordination, balance, bird dog, 8 to 12 repetitions each side, 1 to 3 sets, and a standing anti-rotation exercise, Pallof press, 8 to 12 repetitions per side. Cool down mild hip and lower back stretches, diaphragmatic breathing exercises for 1-2 minutes. 12-week progressive framework illustration, weeks 1-4, motor control and endurance emphasize technique. Supine marching, 10 repetitions, each leg 1-2 sets. Glute bridge, 10-12 repetitions, 1 to 2 sets. Bird dog, 6-8 repetitions per side, 1 to 2 sets. Plank on knees, 3 sets of 15-20 seconds. Take breaks as necessary between sets. Weeks 5 to 8. Capacity enhancement. Augment sets include holds. Supine marching 12-15 repetitions each leg, 2 to 3 sets. Glute bridge 12-15 repetitions, 2 to 3 sets, with resistance band bird dog 8 to 12 repetitions per side, 2 to 3 sets full plank hold, 3 sets of 20-40 seconds. Weeks 9 to 12. Functional complexity and transfer. Incorporate standing anti-rotation. Pallof exercises 8 to 12 repetitions per side. Advance to single-leg bridges if appropriate. Extend bird dog hold duration or add a dynamic crunching element for enhanced coordination. Incorporate farmer carries or loaded carry drills for 1-2-minute walks. Evaluation and indicators of advancement. Quantifiable metrics may enhance compliance duration of plank holds, count of marching repetitions executed without pelvic tilt, duration of single-leg standing, or the capacity to rise from a chair unaided. Enhancements in self-assurance about tasks of daily life, e.g. ascending stairs, transporting groceries, are similarly significant effects. Observe symptoms, record any novel or exacerbated pain, numbness, or tingling during or subsequent to sessions. Should these events transpire, reduce intensity and seek counsel from a doctor or physical therapist. Specific concerns and prevalent clinical situations: osteoporosis and decreased bone density. Refrain from repetitive loaded spinal flexion and severe compression. Prioritize anti-gravity, anti-rotation, and hip strengthening workouts. A physical therapist may provide guidance on secure resistance advancements. Weight-bearing exercises deemed safe and useful, such as walking and modest stair climbing, should be promoted with physician authorization. Chronicle of spinal surgery and disc pathology. Tailor exercise selection and progression. A post-operative rehabilitation protocol often advances from light core activation to more active stability exercises as healing permits. Consult with the surgeon or rehabilitation team about clearance and limitations. Replacement of the knee or hip joints. Adjust supine postures and leg lever mechanics as necessary to prevent irritative situations. Bridges may be beneficial initially for restoring gluteal strength. Modify the range and tempo in accordance with surgery procedures. Cardiovascular constraints. Maintain brevity in sessions and provide regular breaks. Incorporate breathing cues and refrain from Valsalva maneuver, since it may elevate intrathoracic pressure and blood pressure. Exhale with physical activity and inhale during periods of rest. The interaction between continence and the pelvic floor. The pelvic floor collaborates with the diaphragm and transverse abdominis to regulate intra-abdominal pressure and ensure continence. Strengthening the deep core often improves pelvic floor functionality. Nevertheless, some pelvic floor issues need professional evaluation. Refrain from intentional bearing down during core exercises. Rather, promote subtle co-contraction via deep abdominal engagement and diaphragmatic respiration. In cases of urine incontinence prolapse or other pelvic issues, a pelvic floor physiotherapist may provide specialized training. Incorporating core training into everyday activities. The efficacy of functional core training lies on its seamless applicability to daily tasks. Guidelines for incorporation. Engage in TVA draws during everyday activities like queuing, ambulating, or meal preparation brief. Regular activations facilitate the development of automaticity. Engage in micro-exercises, execute a series of bridges while awaiting the kettle, or do a bird dog variation while watching television. To rise from a chair position, both feet firmly bend forward slightly. Activate the gluteal and abdominal muscles and propel upward via the heels instead of depending simply on momentum or hand assistance. When doing lifting chores, hinge at the hips rather than the lower back, keep the weight proximal to the body, and maintain a neutral spine with gentle core engagement instead of breath holding. Safety warning signs and the appropriate time to get expert assistance. Experiencing pain, numbness, or acute feelings during or after physical activity necessitates an instant reevaluation of technique and intensity. In some instances, these symptoms may demand a temporary halt while a skilled professional assesses the underlying reason. Obtain immediate medical assessment if you encounter gradually increasing discomfort or weakness in the legs, recent onset of numbness or tingling in the groin or saddle region, incontinence of bladder or bowel, chest discomfort, vertigo or loss of consciousness during physical activity. It is advisable to see a healthcare physician or qualified physical therapist before starting a new fitness plan, especially for persons with a history of spine surgery. Documented spinal pathology, cardiovascular issues, uncontrolled hypertension, or other serious medical disorders. An adept clinician may do a movement and symptom evaluation, customize workouts to your specific requirements, and instruct proper motor patterns to avert compensatory tactics that may hinder improvement. Frequent errors and strategies for their prevention, emphasizing number at the expense of quality. Performing several repeats inadequately reinforces detrimental movement habits. Concentrate on exact regulated motions and gradually increase volume. Neglecting respiration. Breath retention elevates internal pressure and temporarily rises blood pressure. Synchronize exhalation with exertion and use diaphragmatic breathing. Accelerating too rapidly. Transitioning to extended lever arms, single leg variations, or unstable surfaces before the establishment of motor control heightens the risk of injury. Excessive dependence on machines. Machine isolation seldom correlates with dynamic everyday activities. Include functional and multi-planar components in training. Overlooking the posterior chain. Numerous older persons have predominant anterior chain activity hip flexors due to extended periods of sitting. Include glute and hamstring exercises to re-establish equilibrium. Dietary habits, lifestyle choices, and overarching factors. Core exercise is essential for maintaining freedom and mobility. Addressing sarcopenia and general functional deterioration encompasses engage in resistance training for primary muscle groups 2 to 3 times per week to maintain or augment muscular growth. sufficient protein consumption distributed throughout the day to facilitate muscle recovery, get advice from a dietitian for personalized goals, strategies for optimizing vitamin D, and preventing falls in older persons susceptible to insufficiency or fractures. Sustaining aerobic capacity by walking, cycling, swimming, or low-impact programs to enhance cardiovascular health and endurance for everyday activities. Emphasizing the importance of sleep stress management and smoking cessation, all of which influence recovery and musculoskeletal health. Insights that can be put into action. Summary. When it comes to those over the age of 50, the purpose of core training shifts from focusing on aesthetic goals to focusing on functional goals, safety goals, and the preservation of independence. Effective core training provides the body with the tools necessary to oppose motions that are not desired to allow the safe passage of force between the limbs and the torso, and to maintain balance while engaging in activities that are commonplace. The combination of the supine marching the glute bridge and the bird dog offers a foundation that is well-balanced, adaptable, and validated by research. These exercises activate the deep stabilizers, strengthen the posterior chain, and promote dynamic coordination, respectively. These exercises do not need any particular gear, that they are adaptable to all skill levels, and that they instantly assist everyday tasks such as ascending stairs, standing from sitting positions, lifting items firmly, and maintaining balance on uneven terrain. In contrast, several traditional or machine-based exercises, such as full sit-ups, straight leg raises with extended knees, and different seated crunch machines, may contribute to the development of negative mechanical stress on an aged spine and often make muscle imbalances worse rather than correcting them. It is possible for older people to create a core that has the potential to improve their mobility throughout their lifespan, reduce discomfort, and retain their independence if they place an emphasis on stability-controlled progression and functional movements that represent the necessities of real life. When it comes to core fitness, adopting a purposeful and planned approach becomes an investment in long-term well-being. Practice that is both consistent and intentional, with an emphasis on appropriate activation, progressive development, and awareness of personal limits, makes it easier to maintain one's independence and quality of life. Before beginning any new fitness routine, it is recommended to consult with a healthcare expert or a trained physical therapist in order to tailor a program that is both safe and successful. This is particularly important in situations where there are pre-existing medical or musculoskeletal difficulties associated with the individual. It is possible for older people to considerably improve their trunk stability, reduce pain, and keep the functional capacity necessary for an active and independent lifestyle, if they exercise consistently, have patience, and concentrate on the quality of their movements. Thank you for watching the video. Please let us know your thoughts, and goodbye for now.